We're visiting with Dr. Ankur Lodha with Cardiovascular Institute of the South. You know, heart disease is the #1 killer in the United States, and even during the coronavirus pandemic, everybody has to deal with that. So, Dr. Lodha, how is CIS responding to this crisis?
Well, CS has done very well in the coronavirus pandemic. Part of the concerns of this coronavirus pandemic is how do we really see our patients? How do we get to them? So we are at the forefront of virtual care. We have tried to do and see as many patients in a virtual setting. We do virtual video calling for our patients, where we can screen out a lot of patients for any acute diseases that are having, so that we can avoid them having to leave their houses to come and get exposed. The other thing is a lot of our patients who have chronic diseases, which we can safely manage through a cardio telehealth program, we can take care of them virtually. So that way we avoid crowds of patients coming to our lobby and seeing them and potentially having them exposed. As we see, the coronavirus has exposed a lot of our old patients who are immunocompromised to bad outcomes. In that case, it helps us not to expose them. And even the young patients who have something which is non-urgent and we can avoid them having to come out of their houses, virtual health has allowed us to do that.
All right, that sounds fantastic. Now, how is CIS utilizing technology through this time by providing high quality cardiovascular care? What sort of technology are you using?
So we normally use what is called as the virtual video visits. We just want our patients to have some kind of a smartphone, which is connected to the Wi-Fi. They don't need to have any app or anything for that. What we do is we send them a link through their messages, and as soon as they click their link, they're automatically put onto a virtual video visit, just like I'm seeing you, and we would be able to take care of that. If some people have physical signs that need to be seen, if their legs are swollen, or if they have any wounds on their legs, which we can see through that, they can point their phones and we are able to see them through this virtually.
That's really neat. Now, if they should have to be seen in person, I'm sure you guys are taking precautions, correct?
Yes. So we want very few people to come in if it's really an important thing for them to come in. So first we screen them over the phone to make sure they're not having any active symptoms, which could be suggestive of coronavirus. And then when they do come in our lobby, we have protocols where we are having people sit very far from each other. Every examination room is cleaned after every patient encounter. All of our staff is mandated to wear masks, and everybody in our staff who comes in every single day are being screened for any symptoms they may have, or if they may have come in contact with any of their family members who may have symptoms. That way we provide a very safe environment for our patients to come in if they need to come in. And if some of our patients have concerns about sitting in the lobby, we do have them sit in their parking lot, and as soon as their turn comes, as soon as I'm ready to see the patient, they're brought straight into the examination room to see me.
Very efficient. So, you know, we have to keep in mind coronavirus, COVID-19 is really out there, but folks are still suffering from other things. So if you've got heart issues or you think you have any of those issues, or if you're just in a managed care program with them, make sure you reach out. They are there to help. CIScardio.com. Go to their website. Thank you, Dr. Lodha. Always a pleasure.
Thank you very much.
This first, Acadiana,